Hi guys, it's Mr. Bones here with us today, and we are talking about the shoulder. So the shoulder joint is comprised of a couple bones here, which is the humerus, the scapula, you have the collarbone. This is the articular surface of the head of the humerus. And today we're going to focus on the nerves that travel from the neck to the fingertips, commonly known as the brachial plexus. It joins together through this neck region here and goes through all these little nerves here that go through the shoulder, the collarbone, down the arm, all the way to the fingertips. So sometimes things that can cause injury here, most common is poor positioning. So whether you're looking at your phone too much, you're sleeping in a bad position where your head is forward, the way you're on the couch with too many pillows supporting your head, whatever it might be, you have these beautiful vertebrae below your head, which is the cervical spine. And when the head is down, the disc between each vertebrae will push back on these nerves. And that can cause sensations to run through the neck to the head, like headaches, or you can get pain through the shoulder blade, which I used to get with the dorsal scapular nerve of the brachial plexus. So this is a common one right here, right on the medial border of the scapula. I could go through so many different conditions, but again, posture is the most commonly one when the shoulders are forward. You're definitely pinching this area right in the middle here. I'm going to try to tap on all these bones, but right there. And then let's say maybe you play tennis or golf. You've heard of little league elbow, golfer's elbow. You just have repetitive use, so you can really affect with the musculature of your arm around these nerves here. Carpal tunnel syndrome at the wrist, if you're a yogi like me, always on your hands, a car mechanic, a hairdresser, whatever it might be. There's so many things that can affect the nerves from the neck to the hands. And I'm going to go through a couple exercises today. So stand close to the wall and walk your hands up, and maybe you breathe at the top point. When you're here, your shoulder might want to lift, but you want to draw it down your back. And then you can walk away, straight arm. 3 times, take a deep breath, 3 deep breaths. I'm not going to do it for the time purpose of the video, but then walk it down, 3 deep breaths. Then from here, you're going to turn sideways like this, lateral. Same thing. It's like a warm up. So 3 deep breaths at your end range of the top. Walk it down, elbow straight, hands flat. 2 more times. 3 deep breaths. And then this is when you start. Because it's very aggressive, So from here, hand flat into the wall. Biceps and triceps nice and activated. So it's almost like you're locking out your elbow. And then you can use your head right ear to right shoulder. And that's because I have my left hand on the wall. Sitting up straight, pushing your hands into the wall. So your hand might want to claw off the wall. And you can follow on if you want, but press it into the wall, flat hand. When you look at the tips of your fingers, they might be up here, but look at your shoulder first. If your shoulder's up, shoulder down first, and then draw a line to the wall, and that's where the fingertips go. So it's even lower than you think. Pressing into the wall, sometimes if your body is really rejecting it, I use my body weight almost to really feed into that pressure point, and then I straighten up. Take your opposite hand, you can grab your breast tissue, and turn your whole torso away, and breathe. But so the shoulder might want to lift, push it back down, right? Straighten the elbow. You can relieve it by turning in with the torso and pulling away. Turning in, pulling away. You can relieve it by bending the elbow and pushing away. Bend, push, and then you can relieve with the neck, okay? Next one, you take the hand, but give it a couple circles. Turn it, right? So here, straight arm, same thing goes, pull the breast tissue And then just drop your ear, take 3 deep breaths. And then when you're done, release. And then you're gonna do this. It's like you have 2 cups of water. And then while you're there, you're gonna bring your arms forward. And then it's like you have 2 cups of water, you don't wanna spill it. And you're gonna give it to someone behind you. And 2 cups of water forward. Exhale. Squeeze the shoulder blades together. Inhale, protract them like a cat back. Inhale, push. So the palms always stay up. You keep doing that, and I'm gonna just talk about the figure 8. So with the figure 8 with your nose, it's like a pen sticks out. You can have your hands on the side, but we're gonna go chin down. Inhale, up and back. Down and right, forehead's heavy. Up and back, the back of the head is heavy. Exhale, down and left, forehead's heavy. Then you can switch. Up for the right corner, down to the right chest. Inhale, up to the left corner. Exhale, down to the left chest. To increase tension, you can wrap your hand around the back of your head. Maybe play with this opposite hand for that nerve tension. And then when you're done, you can relieve it up and keep it there.